What are you working on upstairs?
We're live.
Oh, we're live. So health and welfare, we're back and we're looking at H 237 with Representative McCaughan, who's a reporter of the bill. Now, thank you for coming down to be with us this morning.
You're welcome.
So tell us a little bit about the bill, how it, what you might have done to change it or your thoughts on it and the testimony that you had. Yeah.
This bill is probably been around this building, I don't know how long,
A long time.
long time. And, I actually had a constituent who was a doctorate level, psychologist. And, we had some conversations about it. That's how I got involved. And, prior to that, I was involved in the periphery of what was going on over the years.
Yeah.
So, at this juncture, the people are ending up in the emergency rooms. They're ending up in, other facilities, because they can't get taken care of, when they're in crisis. And, this bill, once we get into it, and we have more and more psychologists with a doctorate level that are willing to do the extra work, the rotations and things like that, and take the test and so on that they give. Once they are able to get into the workforce at that level with that specialty, they'll be able to free up primary care physicians who are now, some of them have a psychiatric specialty. They had to because that was the kind of patient they were seeing. And that'll allow them to do their job as opposed to having to come, well, because these cases are complicated. The psychologist is trained in that behavioral aspect of mental illness. So they'll be able to fill that gap, these new doctorate level people, once they get all of the accreditations that they need. So that was the big reason, lack of people in the field to be able to do it. There aren't enough psychiatrists to do it. This will help that.
That's helpful. Thank you. Very good.
I mean, that's basically
That's
why,
it. Yeah, no, it makes sense.
Yeah.
Absolutely.
yeah. And they can do a better job. Because they're trained to do that. If you get a primary care physician with a psychiatric specialty, they do a little bit. A psychologist does it all the way through.
Right.
They're
Good
trained.
continuous treatment and counseling.
They understand.
Yeah.
Yeah.
I asked this question earlier, but I'll ask it of you now that you're here. Do you know how many states do this?
Yeah. Well, I don't know exactly the
Okay,
number. There's about 10 that I listed, when I gave my presentation. I mean, I can look in here and tell you what they are,
Yeah,
but I can't.
but it exists. It's
Oh,
being
yeah.
done.
Yeah, they do
Yeah.
it now and it's safe.
Yeah.
It is showing improvement in terms of the services that a person in crisis gets,
Nice.
and they get it quicker.
Yeah.
So
Good.
we're
We need it.
the states that have it, it's working well. That's the information that we got.
Great. Thank you.
Okay. This is good. Other questions for Representative McCaughan?
Now, just one more thing. There's two ways that you can do this. One is the way that we outlined in the bill, where you have to go through all those rotations and have the collective agreement with the psychiatrist or a provider that has that psychiatric certification. The other way is people in the United States that are doctorate level psychiatrists that have gone through training that is similar to what we do, we will, if this bill passes, that we will do here in Vermont. If, or in Canada, if there are people that want to come to Vermont, or people from other states that want to come to Vermont. If, as long as the training and everything is similar, very similar to what these people have to go through, you can get that certification without the test.
Got it. Okay. And that's in the bill.
That's in the
Yeah.
Section 3, small d.
Oh, boy.
Thanks.
We need
Yeah,
a
remember the
reporter.
states,
We
right?
need a reporter. That's great. Thank you. This is great. Okay. Any other questions?
Would you ask for the vote?
Yeah, what was the vote?
902.
902? Oh, well, and 4 was,
And that little amendment from the Ways and Means, they changed one word. That was the same straw poll vote, 902. Everyone was scored.
okay. Good to know. Thank you for that. All right. Well, we will let you go. I appreciate your time.
No questions?
No.
No, that was my.
Okay.
So, and you know what? Now our committee is adjourned.